Anna, and I will be sharing with you some of my dissertation research on dogs near Serengeti. So, domestic dogs in rural villages near Serengeti National Park are primarily owned for livestock and household protection. These are owned dogs, and they belong to specific households, but they are free roaming and minimally restrained. Dogs in Tanzania are interesting to us because they are a disease reservoir. They can transmit diseases such as rabies, not only to other dogs and other domestic animals, but also to people, particularly children, as well as endangered wildlife, such as African wild dogs. And as such, they pose both a public health and conservation concern. In fact, domestic dogs are an extension of human impacts on the environment because of the risk of disease transmission potential that they have towards wildlife. And as you can see, this is a very dramatic photograph that was just taken a few weeks ago this January by one of our colleagues on the Line project, Ingela Jansen. And this is what we suspect to be a rabid dog that ended up attacking and biting this rather confused looking young male lion. To mitigate these effects, the Serengeti Health Initiative, which is a consortium of partners which includes the Lincoln Park Zoo in Chicago, as well as Washington State University and University of Glasgow, has been vaccinating domestic dogs for rabies, canine distemper, and parvovirus in a 10-kilometer radius surrounding Serengeti National Park since 2003. And for the most part, this vaccination campaign has been largely successful. In the last about 12 years, we've really only had one case of canine rabies in Serengeti National Park, and many of our vaccination villages have reported no human deaths due to rabies in the last 10 years. However, vaccination programs could have impacts on the dog population. You could envision that as disease incidence decreases, survival may increase, reproductive rates may increase, and this could lead to an increase in dog population growth. And as we've been learning this week, that could have implications in terms of dog welfare, ownership, but also from a purely logistical standpoint in continuing these vaccination programs. More dogs mean more vaccines, more manpower, more funding needed. And so for my dissertation research, I decided to answer a relatively simple question, and what is it that regulates this dog population? Is it disease? Is it ownership practices, resources, or wildlife predation? And I really wanted to get a sense of what is dog life like out in these villages? And so what we did is we worked in 4 villages west of Serengeti National Park in Tanzania. The 2 villages in blue, Sanungu and Nangala, are part of the existing dog rabies vaccination program. The 2 villages in red, Buyubi and Iogelo, are our non-vaccination or control villages. And all 4 of these villages are primarily Sukuma tribe and agro-pastoralist. We employed several methods, including mark recapture, where we walked house to house and caught and assessed as many dogs as we could and gave each of those dogs a unique ID. We photographed those dogs and marked them with either ear tattoos and/or microchips. We also conducted some basic health assessments, looking at body condition. We collected fecal samples to look at fecal corticosterone and IgA, and we also assessed them for presence of fleas and ticks, scars and wounds, and any sort of injuries. Finally, we collected basic demographic information from the owners, such as births and deaths and any sort of sickness events over the course of the year. We collected household surveys to really get a sense of what are these households like? What do these dogs deal with? So how many people live in these households? How many kids? How many livestock do these owners have? And then we sat and talked to the owners to really find out, because again, as we've been learning in a lot of these talks this week, dogs exist in many of these contexts because of people. So what does it mean to own a dog in these rural villages? What do you feed your dog? Do you spray your dog for fleas and ticks? Do you participate in vaccination? If not, why? And we also conducted village-wide censuses. Our original our original sample size in 2010 when we began was, we began looking at all households. We started with 420 households. So on average, we were targeting about just over 100 households per village. To give you a sense of how big these villages are, they're just over 4,000 people, and the village-wide census revealed that we were looking at just over 500 dogs per village. Now we assessed and marked about 300 dogs per village, so we were looking at about 60% of the population. In 2010, we began with a cohort of 1,243 dogs, and then we went back to those households year after year to see what happened to our dogs. And we enrolled 1,417 new dogs, and recorded the deaths of 1,253 dogs. And along the way, we did also have about just over 360 dogs that were lost to follow-up, most of which were puppies that were given away when they were just a few weeks old, and just a handful of people that moved away from the village. So our total study population was 2,649 dogs. We noticed patterns across all villages and across all age classes of a male-biased sex ratio. We also found that males had a higher survival rate than females. So males had just about a 10% higher survival rate overall than female dogs, and that was regardless of which village these dogs were in. In terms of reproduction, mean litter size was about 5 pups per litter, but ranged anywhere from 1 to 9 puppies. Most reproductively active females had about 1 to 2 litters per lifetime. We even had one female that had 6 litters during the time that we were in these villages, so she was having about 2 litters a year. The age at reproduction, most females had puppies around 1 to 3 years of age, but we had a female that was about 8.5 years old when she had her last litter. And we did find some seasonal effects, with most litters being born between May and August. When we looked at survival, we initially began looking at this as survival from year to year, and this is data that I presented at the first dog conference. So survival from 2010 into 2011, where we found on average adult dog survival was about 70%. Pup survival was significantly lower, about 40. But we found some village effects. Now, the 2 villages on your right, Nangala and Sanungu, are the vaccination villages. On the left are Buyubi and Iogelo, the control villages. And one of our control villages had similar survival rates to the 2 vaccination villages. But Iogelo, one of the control villages, had significantly lower survival. And we were told by the villagers that there had been a rabies outbreak. Fortunately, we don't have samples to confirm this, but just from rabies reports and surveys in the village, we suspect that there was a rabies outbreak, possibly even a distemper outbreak during this time. When we looked at survival from 2011 into 2012, again, we saw some differences between the villages, with Nangale, one of the vaccination villages, having higher survival. And so at the end of the 4-year study, what we decided to do is actually look at this using survival analysis. And we used Cox proportional hazards models to look at overall survival across the whole data survey time. And we found that Iogelo village, which is the red line, had significantly lower survival overall. But Buyubi, Nangala, and Sanungu, so Buyubi is one of our control villages, had similar survival rates to the vaccination villages. In terms of differences in age class, pups and juvenile dogs had significantly lower survival than adults and seniors. And we also collected body condition scores. So just to give you an example of the things that we would see, we scored body condition score on a scale of 1 to 9, where 1 and 2 is poor body condition, 5 is ideal, and your 8 and 9 would be obese. And this is just a better example here. You can see the body condition score of 2. This female dog is clearly in poor body condition. You can clearly see all of her ribs and all of her vertebrae. Compared to this body condition score of 5, or an ideal dog, where you can't necessarily see his ribs, but he still has a nice abdominal tuck. body condition score was similar across all villages, across all years, with most of the dogs being in this body condition score 3 category. So while we did have some really skinny dogs in poor body condition in the 1s and 2s, and we also did have some dogs in ideal as well as a few chunkier dogs, most of these dogs were lean. And these are lean working dogs, so most of them were in this 3 category. And then you'll also notice this big emptiness in the 8s and 9s. We didn't really have any fat or obese dogs. But body condition score does matter. We were able to find that body condition score could be used as a reliable predictor to predict survival into the next year. Again, regardless of which village or vaccination status, where our body condition score 1 dogs only had about a 30% chance of surviving into the next year, compared to our ideal dogs, which had over an 85% chance of surviving. This followed through when we did survival analysis and looked at the full data set across all the years, looking at body condition score in the previous year and whether or not the dog had survived into the next year. And so this blue line at the bottom, that's your body condition score 1 to 2. So your super skinny dogs had significantly lower survival across all years as compared to the slightly bigger dogs, the ideals or the dogs that were at body condition score 3. In terms of causes of death, sickness and hyenas were our top 2 causes of death. But we found something interesting. In the vaccination villages, hyena predation was the top cause of death, whereas in the control villages, sickness was the top cause of death. And this is something that we're looking to tease apart as we get a little bit deeper into this data set. Other causes included roadkill, people fighting with other dogs, some leopard predation. We also had a dog that was pecked to death by ducks. That couldn't have been fun. And then when we looked at our village census data, we found something interesting as well. The top 2 lines, the navy and the purple, which are Nangala and Sanungu, the 2 vaccination villages, we saw an increase in the total number of dogs in the village between 2010 and 2012. But in 2013, we saw a decrease in that number of dogs. And unfortunately, we don't have data to follow this up, but it would be interesting to see what has happened since then. And then finally, the human to dog ratio varied year to year and varied slightly by village, but was anywhere from 6 humans per dog to 9 humans per dog. So in summary, we've completed 4 field seasons, marked over 2,600 dogs, and we're seeing patterns of higher adult male survival, body condition score influencing survival, and some village effects. And this is data that I apologize, it's an update from what is in what I submitted for my abstract. We have now done some data analysis that reveals that within the vaccination villages, vaccinated dogs did have slightly higher survival rates than non-vaccinated dogs. We're still teasing this data apart to see whether or not these were dogs that were continuously vaccinated each year of the study versus dogs that were only vaccinated 1 time or 2 times. And so I'm looking forward to continuing doing my dissertation analysis and looking at things such as the ownership practices and household characteristics. And how does livestock ownership, for example, if you own more cows, do you own more dogs? If there are more children in the household, are there more dogs? As well as looking into specific ownership practices such as feeding practices and parasite prevention and how that may relate to survival. We're also going to continue looking at our village census data and look at dog spatial distribution as well as vaccination coverage in the 2 vaccination villages. And finally, wildlife interactions. Now, as you can see in these particular villages, that is something that we do face, and the risk for disease transmission into the wildlife population in Serengeti is high, and so we want to get a sense of how often are these dogs coming in contact with wildlife. So there's a lot of people I need to thank. Definitely want to give a shout out to Chunde Bigambo, who's my field assistant, without whom I probably would not have been able to catch 2 dogs, let alone over 2,000. And ICAM and IFA for helping support me being here. And thank you for listening and paying attention. I'm happy to take any questions that you may have.
Thank you. And any questions?
Anna, thank you very much for a wonderful presentation. Could you perhaps just specify the vaccination that was used? Does it refer to a rabies vaccine only, or is it the multiple antigen vaccine?
That's an excellent question. So I apologize for not clarifying that earlier. We vaccinated for rabies, canine distemper, and parvovirus.
Thank you, Anna. Great presentation. I just had a question about the hyena predation. Was that based on what people told you? How often did you actually witness hyenas predating? And could the effect in the vaccination villages be due to their proximity to the park, closer proximity to the park?
Thanks, that's an excellent question. Yes, one of the factors that we considered when we looked at this data was by sheer design of the vaccination program, the 2 vaccination villages are within 10 kilometers of Serengeti National Park. And so is the presence of hyenas there higher than hyenas in the non-vaccination villages? And we did set out to confirm this using camera traps, which we had a couple of issues with because kids really love to visit camera traps. We do have resident hyenas in the non-vaccination villages. We're working out exactly whether or not we can get exact abundance estimates on those. But there are hyenas present in the non-vaccination villages. We also collected data on wildlife sighting. So we talked to owners about how often do you see hyenas, leopards, jackals, so on and so forth. And when upon a preliminary analysis, both in the non-vaccination villages and in the vaccination villages, hyena presence in the village was similar. Now the other part of your question in terms of witnessing hyena predation, I have not witnessed a hyena eating a dog, which from a very sick scientific standpoint, I would really be interested in seeing that. However, all of our death data was owner reported. And so we would sit down and talk to people about, if your dog died, what happened? And hyena predation was very prevalent in these villages, both in the vaccination and non-vaccination villages. And in terms of sickness, we also tried to get information about what were the symptoms leading up to the ultimate death. Was there vomiting, diarrhea? That's still stuff that we are going through, that we're trying to analyze and see if there's anything we can pull out of that. But yes, it was all owner reported. And just to quickly mention too, we also have some data on livestock predation, hyena and leopard predation of livestock, which may also we may be able to couple that with this data to see, whether or not in fact there's a correlation.
Hi Anna, excellent presentation. I just have a question regarding the seasonality that you observe on your study. I'm just curious whether if was any season in the weather in this location, like raining season or something that play a role in having that seasonality effect?
Yeah, we suspect that is one of the reasons that we're seeing a spike in reproduction in the beginning and end of summer, is because, so usually rainy season in these villages would be just about March, April, tail end of very beginning of May. So we suspect that has something to do with it. The other thing that we are also going to try to get a sense of is how does pup survival fall into that? Do pups have a better chance of surviving if they're born during this, which we assume to be a time of plenty immediately after rainy season, as compared to some of the drier months? But that's still data that we're teasing apart from the data set.
And last question?
Just a quick question. Did you mention that you gathered data on fecal testosterone?
We did not do fecal testosterone, unfortunately. We collected for corticosterone and for IgA.
And could you just comment briefly on what your plans are for those data?
Sure. So we did, with the corticosterone, unfortunately we're not always able to get, surprisingly, enough fecal material to run a full analysis on it. So we were doing, we only had a small sample size, and this is one of the reasons I didn't present the data. But in terms of differences in stress hormone between males and females had a slightly higher level of stress, but it was not a significant result. We also did not see any differences between villages, between vaccination status, or between body condition score. But the only pattern that we started to see was a slightly higher fecal corticosterone concentration in female dogs, but it was not a significant difference. So, and then we never really coupled that with the reproductive data. So whether or not that was due to reproductive stress or whether or not these were lactating females, we have that data, we just haven't analyzed that part of it yet.
Thank you.
Welcome.